President Trump is claiming that the World Health Organization failed to warn the U.S. about COVID-19 because of a perceived deference to China. But now the Washington Post reports that more than a dozen CDC health experts were embedded full-time in the WHO headquarters in Geneva, transmitting real-time information about the spread in China to the administration as early as December and then continuing through January and February. Joining us now is Gayle Smith, President and CEO of the One Campaign, former head of USAID under President Obama. Gayle, it's great to see you. Thanks for joining us today. It's also, of course, a complete disconnect between the president now criticizing China so strongly, trying to scapegoat China, if you will, which, of course, has not been transparent and is clearly not reporting accurate numbers, after throughout January and February praising China and praising President Xi. But what about this attack on the WHO? You know the WHO so well. They made mistakes. They weren't as clear-cut as they could be. But if you look at the guidance, all the fact checks show that there were strong suggestions as early as January 14th in some of their briefings, if not their tweets, that there was a problem in Wuhan that had to be that people had to be alerted to.
Right. I think that's right, Andrea. And I think the other thing we need to remember is that when we are on the other side of this, it's going to be necessary to do a global after action and see how countries performed, how international institutions informed, and there'll be plenty of time to look at the facts so that we can plug the holes and be ready for the next one. I think right now, viruses really like it when we're distracted. And I think having a debate right now at a time when the WHO is a critical player in the ongoing response to the pandemic right now today. And in particular, developing countries around the world, Africa, Asia, Latin America, are quite dependent on WHO for information, for guidance, and for actual support. So I think it's really important to support the organization now and to focus on the real challenge we have before us, which is winning against this pandemic.
And there's a lot of other things that the WHO does, ongoing surveillance of polio and other terrible diseases that we're not even discussing when we talk about let's cut off, $400, $500 million annually from the WHO, right, whether or not it's legal. And some on the Hill say it's not legal to freeze that money.
Well, look, at a time like this, we need to use all the tools that are available to us. WHO is delivering assistance right now in addition to providing guidance and surveillance information. So many of the supplies that are needed, the UN provides, for example, in Africa, where we're seeing an increase in the number of cases and all the patterns that we've seen elsewhere. So again, I think the urgency of the moment is to do everything we can to respond globally to this global pandemic, because the fact of the matter is we can't end it somewhere unless we end it everywhere.
The Guardian has written, in fact, that U.S. hostility to the World Health Organization scuppered, basically killed, the publication of a communique by G20 health ministers on Sunday that committed to strengthening the WHO's mandate in coordinating a response to the global coronavirus pandemic. A 6-paragraph statement made no mention of the WHO, but referred to systemic weaknesses in the way in which the world handled pandemics. And earlier, it basically got in the way of a G7 statement that was supposed to come, with the president objecting and Mike Pompeo on a foreign ministers meeting also objecting because of the WHO. So it really is hurting a global response that otherwise could be taking place.
Well, I think in pointing to this systemic weaknesses in the response, again, one of the things we learned after the Ebola epidemic was you go back after the fact and you look at where the gaps are. And there's been extensive work done on this, and there are huge gaps in the ability of countries to prevent and detect and respond to these kinds of viral threats. I think the other thing is we need the G7 and the G20 right now to be focused on the international cooperation we need to make progress against the virus. If it's moving faster than we are, it's winning. Right now, it's moving faster than we are. So while we saw some positive things out of the G20, for example, on debt relief to the world's poorest countries, what we need them to do is be forums for agreement and moving forward and quickly. Again, distractions don't help us. The time to look back on how all of us performed is when we're on the other side of this.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.